Okay, shoulder slides. This is really gonna work all the muscles surrounding your shoulder blades. It's gonna work through the shoulders and across the chest a little bit. If your surgery was relatively recently, this one might feel very frustrating because these are the very muscles that are hard to activate. You might have, after surgery, also you might have a lot of numb places and things just might not want to work the way your brain usually feels like they should work. So it's really about connecting your mind to your body and just practicing, strengthening those muscles and just really retraining your body how to do things that it used to know how to do, and maybe it needs to maybe relearn these things. So taking your time here and really just be sure to use your brain a lot on this one. Arms are going to extend straight out in front. So think about them coming straight out from the shoulders. Also here, there might be a tendency, you might feel your shoulders really riding up. What you want to do is think about those shoulder blades coming low down your back so that your arms, now imagine them sitting on a shelf and they're just going to be sliding across the shelf, but they're not going to go higher or lower. They're going to stay right here. So think about, I don't know, maybe you're Superwoman, Wonder Woman. You're straight out like you're flying because you are Wonder Woman. So here, your shoulder blades are pretty neutral. They're drawn down the back, but they haven't really moved yet. You're gonna take a deep breath in and out. And on your next inhale, slide your shoulder blades closer together. So you're drawing your arms back and then you return to the center on the exhale. Next inhale, you slide the arms forward so the shoulder blades sort of peel apart, and then you draw them back to center. So every time you draw the arms back, you're inhaling, then you exhale back to that start position right there in the middle, and then inhale, reach forward, exhale back to center. So just keep going with that, but because I'm facing you, it might be a little hard to see where are my arms going. And if you're starting to feel incredible, like intense sensations in your shoulders, that's okay, because this is really hard work. So don't feel frustrated with that. So if I were to face the side, excuse my kitchen chair, this is the best one that I have for finding sort of that 90-degree angle in the hips and the knees. So you can be in the chair or on the edge of the bed. So once again here, arms are just straight out in front, belly is gently scooped, shoulder blades are slid down the back, and then with an inhale, you're sliding them back, exhale back to the start position, inhale, sliding forward, exhale back to center. So see if you can go, if this is the first time you're trying this, maybe just 3 in each direction will probably be a pretty big challenge. And then as the days pass, try to work up to maybe 5 and then ultimately 10 in each direction. But again, this one's really challenging. So if it looks so simple, you might feel frustrated, like, why does this look so easy, but it's hard? It's because those are hard muscles to activate, whether you've had breast surgery or not. And so give yourself a little grace and just start small and then increase each and every day.